Hi everyone, Dr. Luke Peterson here, physical therapist with the knee replacement therapist. Common question I get is what are the noises that I'm hearing after my knee replacement surgery? So the clicking, the clunking, the snapping, the popping, all these different noises that I'm hearing after knee replacement surgery. And the follow up question, of course, is should I be concerned or worried about this? So, first of all, what? So, what is causing the noise could be a couple of different things. So, one of the main possibilities, and typically what it is after you have a knee replacement, you have your new knee, which is made of metal parts as well as some plastic parts. And as your knee is bending and straightening, the different metal and plastic components are going up against each other. So they might be kind of rubbing or kind of lightly hitting or tapping one another as they're moving. And as your knee is recovering, as you're building strength, as the swelling is decreasing, the mechanics of the knee joint aren't necessarily in this perfect position quite yet. They haven't kind of found their spot yet. And so that's why there can be some of that kind of bumping up against each other, the plastic and the metal component, and that makes some of those little clicking sounds and different noises that you might hear. Another reason you might hear some noises is due to the swelling and fluid in the knee joint. Just as that fluid and swelling is moving around when you're moving the knee, you might hear some different noises with that as well. And the last main reason that you typically hear some noises is due to the tendons and ligaments within the knee and on the outside parts of the knee. So these tendons and ligaments are going through some changes just as how with your knee changing. So there's changes in how big your knee joint is. You know, it went from probably being smaller to a little bit bigger with the swelling, and now it's decreasing a little bit with the swelling. So these tendons are adjusting as well. They might be too taut or tight, or they might be a little lax or too loose. And as these tendons kind of adjust, so to speak, and these ligaments over time, there's a little bit of those snapping and clicking sounds that you might hear as well. Now, is this something to be concerned about? In most instances, no, it isn't. So typically what happens is initially your knee after surgery has a lot of swelling. So you typically might not hear that many noises in the first couple of days or week or so after your surgery. And then as the swelling decreases, then you probably maybe start to hear some of those sounds a little bit more. Now, what happens typically is as you build that strength, especially in your thigh muscles, your quadricep muscles, the stability of your knee joint and the strength around it starts to improve. And as that improves, typically the sounds get less and less and dissipate and are less frequent and less intense to the point where they're very low frequency or you don't hear them at all. In some instances, though, it can be worth um, consulting and following up with your surgeon to kind of see if the sounds are something to be concerned about. And some of the red flags are one, if you have significant pain or a change or increase in pain that is accompanied with the sound or the onset of the sound. If you have increased swelling that is accompanied with the sound. If there's a change in kind of the joint, so there's almost like a deformity in the joint, like alignment, that might be something concerning and worth following up with the doctor. And the other thing is if you're 6 months, a year, or more out from having your knee replacement surgery and you haven't had any sounds or noises, and then there's kind of out of the blue this onset of noises and sounds. That's another reason to be possibly concerned and at least following up with the doctor. And so those are kind of the red flags. In other instances, if you have these noises and there's no pain or there's no swelling or discomfort, it's probably something that you don't have to be worried about, and it will hopefully decrease and be less and less over time. Now, there's one other thing I want to touch on, and that is something called patellar clunking or kneecap clunking syndrome. And what happens with this is after surgery, you can develop some scar tissue underneath your kneecap. And what happens is when you bend and straighten your knee, this scar tissue kind of gets stuck and gets in these compromised spots underneath your kneecap. And this is what can cause some of that clicking or even like more of a clunking sound as your kneecap and the scar tissue are trying to move together in a limited space that they have. Now, if this is very painful, it might cause some impairments and some symptoms. What is a possibility is, of course, you want to follow up with your surgeon and talk to your surgeon about this. But there is arthroscopic surgery they can do, so going in with the scope and basically removing that scar tissue. And typically, by doing so, that helps improve the movement of your kneecap, decreases that clunking sensation. So that's kind of a special circumstance that you should think about. Typically, it's something that, you know, if you're 3 months out, 12 weeks out from surgery, maybe a little bit further out than that, and you're still experiencing this clunking sensation, it might be something worth consulting with your surgeon to determine kind of what is the appropriate next step, if anything. All right, so hopefully that helps answer that question about what are the different noises and should I be concerned or what should I do about it. And I hope you got some useful information, and be sure to check out some of my other videos. I post on a fairly regular basis, all things related to knee replacement and the knee replacement journey. Have a great day. Take care, everyone. Thank you.